Hi, my name is Jiawen and this is my final presentation of maple syrup urine disease. Before I start my presentation, I want to show you guys a picture of two types of urine. On the left side, this is the normal urine, which presents in yellow. On the right side, it is the urine from maple syrup urine disease patient. The color is darker and it looks like maple syrup. It also smells like maple syrup. The maple syrup urine disease is an amino acid disorder, which means your body has trouble breaking down amino acid. It is a genetic disorder that patients who have this disease do not have the enzyme to process branched-chain amino acid, and resulting in unusual yellow crystal in urine. Maple syrup urine disease was first been noticed in 1954. Dr. Menkes and his colleagues reported a family of 4 infants died from neurologic disorder. The urine of these 4 infants had the similar smelling to maple syrup. Therefore, the name of this disease is called maple syrup urine disease. Later in 1960s, Dr. Dances identified the pathological result of this disease that lacking enzyme to metabolize all 3 branched-chain amino acids and accumulate their byproduct in the body. Maple syrup urine disease was treated successfully by limiting oral intake of branched-chain amino acid. In addition, newborn screening program was launched for identify the risk of maple syrup urine disease. The maple syrup urine disease affected an estimated 1 in 185,000 infants worldwide. Moreover, the severity and the effects of this disease are very different in patients, and they are related to the amount of remaining enzyme activity. The most classic symptoms of this disease are starting with the difficulties in feeding and increasing lethargy, which lead to weight loss. Further, patients appear to irritate and vomiting. In the end, serious conditions cause respiratory system failure and death because of the central neurologic function faults. The mutation shows in the genes of branched-chain keto acid dehydrogenase enzyme complex, in particular to BCKDHA, BCKDHB, and DBT. We will discuss them in the next slide. The maple syrup urine disease is a genetic disorder, which means it is caused by gene mutation. The main responsible genes are branched-chain keto acid dehydrogenase E1 subunit alpha and branched-chain keto acid dehydrogenase E1 subunit beta and DBT. Without mutation, these 3 genes work together to provide instruction for catabolism of branched-chain amino acid of isoleucine, leucine, and valine. However, the function of these 3 genes are disrupted when mutation occurs. It could be adding, deleting, or replacing in the DNA sequence of the genes. Therefore, there is no enzyme to break down the leucine, isoleucine, and valine, and their byproduct will accumulate in body and cause health problems. Maple syrup urine disease is an autosomal recessive disease, which means both 2 copies of genes of each cell has mutations. The genotype of this disease is a. The special case of autosomal recessive disease is the disease carrier. The carrier has only 1 copy of mutated genes in their chromosome, and the genotype is a. However, the carrier do not have any symptoms of the disease and they are normal. In addition, the carrier will have a chance to pass their mutated genes to their next generation. The pedigree is the chart to show the genotype of a certain disease within a family. This is the pedigree I create to help you have a better understanding of autosomal recessive disease. Let's take a closer look into examples. First, I want to point out that the pink dot represents a carrier who has only one mutated gene but do not have the disease, and the blue dot represents the patient who has the disease. In this picture, Dylan and Haley are carriers. The genotypes of their offspring could be big A, big A, and small a. Since maple syrup urine disease is an autosomal recessive disease, the probability of their child having this disease is 1/3. Mitch is the maple syrup urine disease patient, and Cameron is carrier. The genotypes of their offspring could be big A, and small a. So the probability of their child having this disease is 1/2. The last part I want to mention about is the genetic testing. The genetic testing is a type of medical testing that identifies changes in genes, chromosomes, or proteins. The results of genetic testing could help determine people's chance of developing certain disease. There are many genetic testing in the market that could help people to see whether they have the disease or not. The one I found is a biochemical genetic testing, and it is an optional testing. This testing is targeted to 3 types of people. The first is infant with a positive newborn screening result, which shows a possible genetic disorder of branched-chain amino acid metabolism problem. The second is patients who have significant elevation of branched-chain amino acid in the body, which indicates sign of branched-chain amino acid metabolism problem. The third is the patient diagnosed with maple syrup urine disease. The early detection is very important. Untreated patient has elevated plasma concentration of branched-chain amino acid. Serious condition of maple syrup urine disease will lead to central respiratory system failure, coma, and death. Therefore, it is very important to detect earlier. The cost of this testing is very different in infant and adult. For infant, it costs $15 to $60 per infant. For adult, it costs around $690 per adult. In addition, the health insurance company will cover the most cost of genetic testing when they are recommended by their doctors. This is a blood test, so there is no harm. However, the screening test for newborn infant has the risk of false positive and false negative result. The false positive result leads to additional testing and cost. The false negative result will lead to delay in treatment. Meanwhile, newborn infants with normal results should be monitored regularly because some symptoms of the disease may occur later in life. In conclusion, maple syrup urine disease is a genetic disorder characterized by lacking of enzyme to process the branched-chain alpha-keto acid. The mutated genes that are responsible for this disease are BCKDHA, BCKDHB, and DBT. It is an autosomal recessive disease that patients must have 2 copies of mutated genes in their chromosome. Patients have the symptoms of poor appetite, vomiting, and respiratory system failure. There are available genetic testing for maple syrup urine disease in the market, People who are interested in this testing should discuss and contact with their healthcare provider and insurance company in advance. Thank you so much for listening to this presentation and have a great day.